Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links. Proceeds from purchases help to support our show. Thanks for listening.
We hope you enjoy the show. Welcome to PetAbility. I'm your host, Kathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good morning, Kathy. How are you this fine day?
Good morning, Chris. And it is morning. It's early morning today, right?
Yeah, we may not be at the top of our game, but I'm going to try to rise to the occasion.
Me too, because the topic is fantastic.
It is fantastic. So today we are talking about patellofemoral luxations. And I know that sounds complicated, gobbledygook, but what that means is when a pet, specifically a dog, we're going to talk about dogs mainly here, but that their kneecap dislocates. So as a physical therapist for people, before I got into the field of doing physical rehab with small animals, a fair amount of that. And in people, it would be really traumatic for it to actually dislocate, but there was often a lot of pain associated with tracking problems of the kneecap and so forth. But today we're going to dive into patellofemoral luxations with a surgeon friend of mine.
I will tell you this, Chris. I actually dislocated my left knee. I hit it on the side of the couch and it just popped out and popped back in. And man, was it painful. And so I'm interested to hear what Dr. Pastor has to say about a lot of things about dogs with luxating patellas. Who gets it? Is one breed more likely to get it than another? How do we diagnose it and how do we fix it? So I'm interested to hear that. And if you're a rehabber listening to this, I bet that you've done this. If I'm just out, driving around or walking around, if I see a little dog do that little Skippy step, you know what I'm talking about, Chris? I go,
oh yeah,
that dog, maybe that dog has a luxated patella. Yeah. So I'm sure you do the same thing too. So I'm interested to hear what Dr. Pastor has to say.
Exactly. And I was going to mention that, as a physical rehabber in dogs, it is pretty darn common. And I would say in the top 3 most post-operative orthopedic conditions that I have treated over the last 20 years. I think that tears of the cruciate ligament are certainly up there, surgical procedures of the hip like the FHO, but then, surgical correction or stabilization of that kneecap is definitely in my top 3.
Right. I agree. And my very first pug, he had to have a repair. He had a luxating patella and it was particularly problematic until he got his leg stuck in the couch cushion and then we pulled him out and then it was out all the time and it had to be fixed. It was pretty,
right.
Yeah.
So we've been wanting to get a expert on the show, to talk about this. So enter Dr. Karen Pastor. So I'm going to tell you a little bit about our history together. So I was invited to help start the physical rehabilitation service at Massachusetts Veterinary Referral Hospital back in 2006 and had the pleasure of working side by side with Dr. Pastor. And, I think that she was a little ahead of her time because she really embraced physical rehabilitation at that time. And we collaborated wonderfully to heal patients together. She did the diagnosing, she performed the surgeries if needed, and then referred them over to physical rehabilitation. And then if things weren't going exactly as I expected, I'd refer them back to Pastor. And we just had a wonderful relationship. So let me tell you a little bit about the nitty-gritty of Dr. Karen Pastor. So she received her degree, her veterinary degree from Tufts University here in New England in 1992, and then went on to complete a 1-year internship at Animal Medical Center in New York City. From there, she completed a 3-year residency in surgery at Tufts and Angel Memorial Animal Hospital in 1996. And we're all familiar here with Angel because it's the longest continuously running animal hospital in the world. Dr. Pastor is board certified in veterinary surgery by the American College of Veterinary Surgeons. She joined Massachusetts Veterinary Referral Hospital in 2003, where she remains today. So she was and is the anchor surgeon at that facility. Her special interests include oncologic, urologic, and orthopedic surgery, which is why we asked her to join us today. Karen Pastor, welcome to our show.
Welcome, Dr. Pastor.
Thanks, you guys, for having me. I'm so happy to be here.
We're excited too.
Well, it's interesting because just yesterday I had 6 appointments and 4 out of 6 of them were patellar luxations.
So, Dr. Pastor, when you're talking to these clients, as you were yesterday, how do you describe what a patellar luxation is? Because I know it is confusing, I think, to a lot of clients, and it's hard for them to understand.
You know, it's interesting. I do have a lot of bone models in my exam room, so I can show them because I feel like looking at things is much more effective than just talking. So I do show them models, and our knee is very similar to a dog's knee. And I tell them that all of the ligaments and patellas and kneecaps, all of that is the same. The only difference is dogs walk up on their toes and we walk down on our foot. So as far as explaining things, a lot of people, it's funny, a lot of people say, oh, I have a patella luxation. And Kathy, I was listening to you saying you had one as well. Clients a lot of times have same diseases as their dogs. So a lot of people are familiar with patella luxations as well. And it's mostly toy breed dogs that we see, but we're seeing a lot more large breed dogs now. And large breed dogs are a little trickier than the small breeds, but still the majority I see are the toy breed dogs.
Do you think that the larger breed dogs are more complicated because of conformation? So I have some patients that have like tarsal torsion or to have hip dysplasia and rotating out of the hocks, where I don't often see that with the smaller breeds. Is that part of the complicating factor in these larger dogs with patella luxations?
Yes, exactly, Kathy. You're right on. A lot of these large breed dogs have a lot of angular limb deformities. And so the conventional surgeries that we do in toy breed dogs oftentimes don't work in the large breed dogs. So there is a different procedure that we sometimes have to do with large breed dogs that have patella luxations. The other difference is most toy breed dogs have medial patella luxations where your kneecap actually pops to the inside of your knee. But we also see lateral patella luxations where the kneecap pops to the outside of the knee. And I will say that that's definitely not as common, but we see it more in the larger breed dogs versus the smaller breed dogs.
I remember way back when I was getting certified in rehab, they talked about certain breeds at that time. And keep in mind, this is way back in 2004, that did have the lateral luxation. There was a breed disposition, I think, for the Basset hounds to have sloppy kneecaps and go either way.
Yes, the Basset hounds, and we saw it in labs, and the Bernese Mountain Dogs as well. We would see it, and Newfoundlands.
Oftentimes it's referred to as MPL, and that's an acronym that stands for medial patellar luxation. Do you
Correct.
think you can describe the kind of the biomechanics of why in those little toy breed dogs that kneecap wants to go inside? What is going on anatomically and with the soft tissues and so forth that predisposes them?
So it's obviously thought to be some sort of an inherited disease, and we're not sure why this happens in these dogs. But 2 things happen. One is they get a little bit of a curvature in their tibial tuberosity, or their tibia, which is the bone below the knee. So you have your femur, which is your thigh bone, and then you have your tibia, which is the bone below your knee. And as they grow, they get a little bit of a curvature in that tibia. And so the importance of that is you have your quadricep muscles that come up over your thigh on the top of our thigh, and they all come together to form a tendon called the patella tendon that goes over our kneecap and then attaches to this little protuberance of bone below your knee that you can actually feel in your own knee. And that protuberance of bone in some of these dogs is more on the inside of the tibia instead of the center of the tibia. And so what happens is your quadricep muscles, instead of being on top of your thigh, are actually more on the inside of the thigh. So when they flex their knee, that pulls that kneecap over. And so over time, if that kneecap is going in and out, the other thing that happens is these kneecaps, they sit in a little trough or groove And what happens over time is if your kneecap is constantly popping out, it's going to wear down this ridge, and that nice trough or groove is going to become more flattened. So there's nothing really to hold that kneecap in. And that makes the disease a little bit worse, which leads to some changes in the cartilage of that groove and causes some arthritis.
If you're x-raying a dog prior to possibly surgery or trying to make a diagnosis of luxating patella, if you do a cross table x-ray where you just change the beam from up and down to across and you just shoot across the top of that knee, you can really see how the patella is sitting there. It should be in the groove, but sometimes it's just like sitting on top like a shelf. It really gives you a good sense of the fact that it's just not really a groove anymore. It's more like a shelf.
So Dr. Pastor, if somebody comes in to your exam room and they say, I don't know, my dog's limping and I don't know what it is. I'm not, even quite sure what leg it is and what's going on. How do you go about evaluating and diagnosing a patellofemoral problem?
Usually it's by feel, by palpation. I mean, you can really just feel the knee in the exam room on physical exam, and you can internally and externally rotate their tarsus and you can pop that knee out. And then you decide at that point whether they have what's called a grade 1, 2, 3, or 4 patellar luxation. And that's really important. And you obviously want to know which way your patella is luxating. Is it luxating to the inside or is it luxating to the outside? And like I said, most of the time it's luxating to the inside. So the grade on your physical exam is extremely important in deciding the treatment modality for these dogs. The other thing that's very important is the clinical picture of these dogs. Are these dogs lame? Are they skipping all the time? Can they not jump up and off the couch? Is it affecting their quality of life? So those things we talk about in the exam room, but it really is about the physical exam. The x-rays that we would obviously take as well as the next step is really important in looking, as we talked about earlier, is a lot of these deformities, either in the tibia, and also I meant to mention in large breed dogs, you have a little bit more of a curvature in your femur, which is the thigh bone. So you do a lot of x-rays measuring angles and deciding what type of torsion or angular limb deformity these dogs have, and then that can dictate how you're going to fix these dogs.
It's kind of interesting for me because if I see a dog that has a possible diagnosis of a grade 1 or 2, you don't always see it tracking outside of the groove radiographically where you do on 3s and 4s. So it can be a little tricky, I think.
Yeah, just a moment in time though, right? So that's
just a moment in time, exactly.
So your physical exam is extremely important because it is a moment in time. And a lot of these dogs, when you straighten out their legs for their x-rays, it sort of does keep that patella in. So it is about the physical exam for sure. And then complicating things is that if you do have a significant angular limb deformity in the femur especially, the third step is a CT, but that is a lot less commonly done because most of our cases are small breed dogs with medial patellar luxations.
I think you raised several good points there. One, the experience of the clinician in being able to do a good physical exam. And, a lot of my clients, when it comes to diagnosing patellar luxations, cranial cruciate ligament tears, they want that test and they want to be able to see it and know definitively. And I say, no, if you go to a experienced veterinarian, 90% of it is the clinical exam. And, they may do an extra test to verify or rule out something else, for example, the x-rays and things. But I think that's really important. And Kathy and I always talk about how we're so grateful to just be surrounded in the New England area by great clinicians and boarded surgeons and such. And you've also mentioned several times about this angular limb deformity. I often think like dogs that are bow-legged, again, for the layperson, or knock-kneed, but those bow-legged dogs, I think, especially those little toy breeds, I always thought it was kind of like breeding them down into smaller size. It's like, where does the bone go? So it kind of bows out. I'm sure that's not appropriate, but that's how I kind of see it as they're getting shorter and shorter in their stature over time. And an analogy that I'd heard is that the kneecap, the patella, is kind of like a train on a track. And if that track, those bones are curved, you're talking about the thigh bone and the shin bone, the tibia, then that that train has to go around a corner, and that's harder to do. So that kneecap wants to go straight, and so it will pop out to the inside. And so that sometimes people will kind of get it when I say that. And, you also talked earlier about the grades. Can you talk a little bit more about that and how that dictates the treatment going forward?
Yes. So patella luxations are graded 1 through 4. And grade 1 is the most benign, or essentially I can move the kneecap in and out on physical exam, but the kneecap is in and the dog has absolutely no clinical lameness or any clinical significance. It's just something that is incidental that I feel in the room. And the owner's like, the dog's never had a problem. So grade 2 is that the kneecap is in most of the time and spontaneously does pop out as the dog is being active. And the owners do see some sort of skipping, as you described earlier, Kathy, intermittent skipping or intermittent lameness. And then a grade 3 is the kneecap is out most of the time, but I can pop it back in. But as soon as I put it in, it wants to pop back out. And then grade 4 is that kneecap is completely out of the groove and it's just sitting next to the groove. Created, scar tissue is keeping that out and you cannot budge that kneecap. And those are the very challenging cases. Fortunately, most of the dogs that we see are grade 2 to 3.
Which breed is highest risk for patellar luxation?
I think that the larger breed dogs are really the challenge, especially labs. We see a lot of labs that have them, and I think that they just have a lot of deformity. So I think their kneecaps end up staying out and developing a grade 4, where most of the toy breed dogs just stay at a 2 or a 3 and sort of never progress to a 4. The hard part is, who is going to progress to a 4? Because you think over time they all will, but they don't. So most of the time, I see them when they're already grade 4. So it is really hard to predict. I just had a client yesterday who's very concerned. She had a 1-year-old Chihuahua who had a grade 3 and the dog's never been lame. And I guess her veterinarian had just diagnosed it. So they're very concerned. And, what do? Do you do surgery or not? Is it going to progress to a grade 4? And you just don't know. So those are tricky ones where the dog's never lame. So you don't want to fix something that's not broke because the dog's fine, but you also don't want to get them to a grade 4 and then have them come back in a year. And then it's a harder surgery and a more challenge.
Will he progress to a significant osteoarthritis without the repair?
I don't feel like a lot of these dogs get a lot of arthritis that affects them in the future for a patella luxation, but this one was very tricky because there are a lot of surgeons out there that are a little bit more aggressive and they want to fix this patella because it's wrong and it should be in and it needs to be fixed and I can do it and I know how. But there's a lot of complications too that go on with surgery. So you have to balance, complications with a dog who's not lame. So I feel like I have everything to lose with a dog who's completely normal with a patella luxation versus a dog that's not. So what we're going to do with this dog is we're just going to recheck it every 3 to 4 months just to make sure that it's not progressing and getting worse. That's what we've decided, and to be a little bit more conservative.
So you don't do the surgery. It does progress to a grade 4, hypothetically. What's the downside of that? Like if the dog has never been lame, is it likely then to become lame and have functional deficits when it's a grade 4?
Not necessarily. I feel like when it's a grade 4, sometimes these dogs are not lame at all because their kneecap is out. They're used to it being out. It hasn't been in for a long time and they've just been able to adapt. So
and the tissues adapt too around there.
And that's why it's hard. I mean, everything is pulled over and you have to undo all the scar tissue and then correct all the bone abnormalities. And, a lot of times they even will create a new tract next to the normal track. And those are really tough as well. We see those in bulldogs. I think most of the time that I see a grade 4 patella luxation, it's because the dog now, to throw another curveball, is that the dog has a cranial cruciate ligament tear. And so they're coming in because they're lame for that. And the dog historically has an MPL or a patella luxation its whole life. It's 7 years old now. Now it's lame because it has a cranial cruciate ligament tear. So now you're obligated to fix both at the same time. And that's most of the time when I see those grade 4s. Because going from a 3 to a 4 doesn't necessarily change the clinical picture of the dog. Something else has to happen. And so The one thing I do tell clients is that when you do have a patellar luxation and your dog is fine and doesn't need surgery, then sometimes middle age, maybe 4 to 10, they can develop a craniocruciate ligament tear because they're a little bit more prone to that because of this anatomic abnormality in their knee. That if that happens in the future, the dog will be consistently lame. There'll be no question that they need to bring the dog back in. And then we fix both at the same time. So a lot of my surgeries are fixing both of those at the same time.
That's so interesting that you say that, because I have in rehabilitation seen, the post-op reports and the diagnoses, and I'm like, wow, so many cruciate tears go concomitantly with patellofemoral luxations. And so now that makes sense. And I was going to ask you if if the patellar luxation predisposed them to, tearing their cruciate, and you answered that. So
I do warn people, with that 1-year-old Chihuahua, I or any of these dogs, if I don't do surgery, I say that what can happen is in the future, this will happen and we'll fix it at that time. And so people understand that. That's a big part of the talk that we have with these young patellar luxation dogs.
I had a patient recently who was a youngish pit bull, and she had luxating patellas both sides, grade 1 on one, and I think 3 on the other. They repaired the 3, and about 6 months later, she had bilateral cruciate tears. And that's, and she's doing well now, actually. And they warned her that this might happen. And the surgeon actually did a CT scan and sent it out to someone who did a 3D model of the dog's bone so he could practice in the surgery and then going forward with it. It was so cool.
That definitely is technology that's been around, but now we're using it a lot more so that we can pre-plan a lot of surgeries with these 3D CT scans, for any angular limb deformity plus the patellar luxation. Because again, the extent of the angular limb deformities that these dogs have, whether they're a large breed or a small breed, really dictates what type of surgery you're going to do for them. And so it is nice to have all of that information beforehand. Unfortunately, not everybody has access to that,
right.
But because it's very expensive. But it is really nice to have.
Can you go over the surgical options for dogs with patellar luxations?
Absolutely. So the conventional repair of a patellar luxation is usually 2 types of surgeries. One is called a trochlear wedge recession or a trochlear block recession. They're basically the same thing. And when you go into these knees, as I pointed out earlier, the trochlear groove of the femur are very flat because of the fact that these patellas pop in and out and kind of wear down the ridge. So the first thing we do is we go in and we either make a rectangular cut, hence the block, or a wedge cut in that cartilage with some bone, and we put that cartilage in a nice saline bowl next to us. And then we burr down the bone below it, and then we put that beautiful cartilage back in, and it resets down. So you've created a new groove. And it's interesting because I have gone back into these dogs for other things, and that cartilage that we've done that traumatic event to, you would never know I was even there. So it's really remarkable how you can put that cartilage back in and recess it, and they really have minimal changes. And then the second thing we do, and it really depends again on that torsion of that tibia or the shin bone, is that tibial tuberosity, that little protuberance of bone where your patella tendon is, that really offset to the inside of that knee. If it is, then we do what's called a tibial tuberosity transposition. And essentially what you're doing is cutting that little protuberance of bone that you can feel, and you cut that away, and it's still attached to the patella tendon. And you move that piece of bone or protuberance of bone back to the center of the tibia to realign your quadricep muscles so that when you flex, everything now is aligned. So those are the 2 things we do, and how we keep that in place is you put 2 little pins in there, and that holds the tibial tuberosity to its new location. And I would say 95% of these dogs do great. So it's a very successful surgery. After doing that, the other thing that we have to do is we usually make an approach on one side of the patella, and then we make a little approach on the opposite side of the patella so the patella can move back and forth easily, because there's a lot of scar tissue at times on the medial side patella. And so you have to cut that scar tissue and you have to release it. We call it a medial release, where you release both sides of the patella so you can move it easily either direction. And then when you do your deepening of your groove and you move your tibial tuberosity, at that point you decide you have two sides of your patella incisions opened. And so you can imbricate, but sometimes when you imbricate too tight, you can actually pull that kneecap to the opposite direction. And now you've done nothing but change things from a medial to a lateral. So you have to kind of close each side of your patella, almost alternating sutures, so that you can either even it out. There's some cases where you have to put the sutures in evenly. There's some that are really bad and still want to luxate, so you have to imbricate the biceps fascia. There's fascia there that you can tissue around that patella that you can really tighten to pull it to where it needs to be. And sometimes it's so bad that you have to pull that fascia and leave that inside incision completely open, because if you put one suture in there, it's going to pull it back out.
Wow.
So that's a kind of thing that you do in surgery, with playing with your tissues around your patella and tightening things up. And it's tricky. It definitely takes some experience, because the last thing you want to do is make a medial patella luxation into a lateral luxation, and it does happen sometimes.
Well, you said 95% do great. If they don't do great, what are the complications? That it luxates the opposite way, or?
Yep. So it can reluxate the opposite way, but more commonly it reluxates to the same way. So reluxation is probably the most common thing, and you have to go back in and change some of the tissue around the patella. Those two pins that you put in there can either break or they can loosen prematurely, and so you've had implant failure. And then infection is always a complication of any surgery, although it's very uncommon with this particular surgery. So I would say reluxation is the most common. And a lot of times, unfortunately, I think it happens because it's really difficult for, clients to really keep their dogs quiet. These are very young dogs most of the time. They're active dogs, especially the little toy breed dogs that want to jump up on the couch all the time. And it's challenging. And so sometimes if they get too much activity too fast, they can sort of tear that tissue around the patella and it reluxates.
What is the recovery period? When would you say they're out of the woods in terms of going back to normal activity?
For me, I usually say around 10 weeks. So what I tell people is if they decide to do surgery, they would have surgery on a particular day where they come in the morning, they have their surgery. We are very aggressive with pain medication. We do femoral sciatic blocks, which are very similar to epidurals. They get opioids overnight. They stay overnight for that reason. And then the first 2 weeks are really the hardest because they're non-weight bearing on that leg. Their leg is shaved. They have an incision that they need to monitor. They have the Elizabethan collar, the cones on their heads that are annoying that they have to keep on so they don't lick their incisions, and they're on oral pain meds. And as you know, Chris, they need to do some cold compressing and warm compressing and passive range of motion. So it's a lot the first 2 weeks for people. After 2 weeks, and they really need to keep their dogs quiet, so just short leash walks to go to the bathroom, and they either need to be crated or confined to an area where they can't jump up and off furniture or anything really. And then after 2 weeks, they come back. We get this incision, the stitches out if there are stitches in there. We check the incision, make sure everything feels the way it's supposed to feel. And then at that point, we like to start the physical therapy. So either they go to a physical therapy place around the area, which unfortunately is a little bit tough to find these days. And if not, we do passive range of motion. They start walking the dog. So we do want these dogs to walk and not be sitting in a crate for 6 weeks. So slow leash walks, increasing them usually by 5 minutes every week from week 2 to week 6. I like them to walk their dogs 2 to 3 times or 3 to 4 times a day if they can. And passive range of motion will continue when we have little balance things that you've taught us, Chris. And, if they can't get into a rehab facility, give them all your tricks to do at home. And then at 6 weeks, they come back for x-rays if we've done the tibial tuberosity transposition, because we have implants in there that we have to make sure that little protuberance of bone is healed to its new location and to make sure the pins are okay. And at that point, you can kind of sigh a little bit of a relief because your bone's healed, your patella is still in, feels good. So at that point, it's progressively longer to unlimited leash walks for 3 to 4 weeks. And if they're doing well, then I let them go at that point. So I would say around 10 weeks, you can let them back to their regular routine.
Say, I'm thrilled that you mentioned the importance of physical rehabilitation. And I think that, again, it's a specialty. We work, hand in hand with the surgeons, but so many surgeons have, you said, like, there's a paucity of clinicians around here that are doing physical rehabilitation, but over time, due to recognizing that importance, you're also sending pet owners home with specific instructions. I remember back in the old days, it was like, sit in the crate for 6 weeks and then gradual return to normal activity. And that for people looks very, very different, and how they return to normal activity. And it's so important to prepare all the tissues gradually. And so, even though you no longer have rehab at your facility, it sounds like you're giving them very specific instructions on how to progress over that 10-week period. I love it.
Absolutely. And I became a huge believer when you started your program at MassVet that physical therapy is, I think, more important than the surgery, to be honest with you, because I do feel that without it, your surgery is just mediocre. But with physical therapy, I mean, there's strides that you can make these dogs just use their leg faster. They build muscle. I think with no physical therapy, the dogs can do great, but I bet you if you measure their muscle, they're not going to have the same amount of muscle that they could potentially have with physical therapy. So I've been very saddened since COVID, because it really was since COVID that all of these places have closed and they're just not available to our clients, and they have such a long wait. It's been very frustrating for me, but I've been really trying to be aggressive with people and saying, listen, ideally I want you to be at physical therapy. You can't. So these are the things you have to do. And it's hard. I wish, even if these dogs swim, I tell them to swim or wade in the water. Like, I'm pretty aggressive with it and telling them to do things, because again, physical therapy is so important with orthopedic surgery, especially this particular orthopedic surgery.
I think there's also a whole component for the patient where, prior to surgery, they're oftentimes rested, and people come in and they're crying because their dogs want to do stuff and they haven't been able to do anything. And I think this is great, not only for their maybe prehab, what we call before surgery, or post-op rehab, but this mental expenditure and social interaction that sort of tires them out. And because when I tell a client to keep their dog rested, they're like, how am I going to do that? So I think there's a whole emotional component too that's really benefits the patient as well as the physical aspect of rehabilitation.
I agree. And the dogs love it, and I mean, God, I have so many pictures and videos of these dogs, in underwater treadmills with their little cookies, and their owners are smiling and they love it. They're looking forward to coming, and it does kind of break up that monotony of not being able to do something for your, with your dog for 10 weeks, because that's a really long time.
Really long time. And when it happened to me, my first dog who had his patella repaired, and there was a period of time where he had to rest. And I was thinking, well, I'm the person, he's the dog. I'm going to, I can get him to rest. By day 4, I was crying. By day 4, like, okay, now I understand. I can't get how do you get your dog to rest? It can be difficult and challenging and emotionally stressful for the owner.
Absolutely. Absolutely. And that's the part that we don't really see, right? I think, we just say, here you go, here are your instructions, and we just hope for the best. And, some people are like, oh, it was not a big deal, everything went well. And there are other people that are like emotional wrecks. And it is really, really difficult for people. And that's why, it's a big deal to have surgery, and it's a long recovery period. And that's why case selection is so important with patella luxations. Like, how can you justify, putting an animal through all of that, and an owner through all of that, financially, emotionally, with a dog that's not limping at all. And it's just an incidental finding. And so that's the challenge with this. It's not always straightforward. You really have to work with the client with the pros and cons of surgery versus no surgery, and really understand what you're dealing with. And then together we decide whether surgery is the right thing for this particular pet.
And there are probably thousands of little dogs out there with grade 1s and grade 2s that are doing just fine. They're living their lives and doing just fine, right?
Or like you said earlier, I'm like walking down the street and I see that dog over there skipping, and I'm like, oh, that dog's skipping a lot. Should I say something to her? No, I'm not going to.
Can you explain? It's a Saturday, I'm off. Can you explain to the listeners what they're doing when they do that little Skippy step?
Yeah, so what we're thinking is that their patella is popping out, so they're normal and they're running or walking, and then all of a sudden that patella pops out, and so it feels weird for them. So they lift up their leg, and these dogs learn how to sort of do things that put that kneecap back in, whether they stretch out their leg or kick a little bit, and then that spontaneously pops back in, and then they're normal again. I find that this disease is not that painful because when I do my physical exams on these dogs, they don't care that I'm popping their kneecap in and out. I think more so, it just, if you're walking down the street and your kneecap pops out, you're going to buckle. It's going to feel weird. But if you push it back in, you're back to normal. And so, unless it's a traumatic, which, that's a different story. If you hurt yourself, then you have a patellar luxation, obviously it's going to hurt. But these guys don't seem painful to me on their physical exams when I examine them.
I'm glad you mentioned that because I actually wrote myself a note here when we were introducing the show, and Kathy, you talked about your experience and so forth. And, I certainly treated a lot of people in physical therapy, and it is very painful. But like you, Dr. Pastor, I agree. I do not think these dogs are typically that uncomfortable. And I think it goes back to the anatomical predisposition. So it's not that big a deal, if you will, for it to, float in. Whereas in people, it's very traumatic when that happens because there's ripping and tearing and friction and all of these things that happen can even damage the cartilage as it slides out because you have cartilage on the underside of the patella and then on the top of the femur. And so that trauma of it dislocating in a person is much more severe and thus more painful. But these dogs where it's happening due to their anatomy, I mean, it's just kind of like a fact of life, and it can slide in and out. I also wanted to mention, in my experience, and I hope you can speak to this, that the grade 2s and 3s are often the ones that are the candidates for the surgery. Of course, you have to look at the whole clinical picture and so forth. But I've had many pet owners present to the clinic, and their dog has a 2-3, and they do not want to have surgery. And for me, it's really frustrating because it's hard to, quote, cure them through rehabilitation when they had that underlying anatomical issue. And, I'd say less than 50% probably get by with rehab alone. So I do think it's a partnership between the surgical team and the physical therapy team to ultimately correct these. What are your thoughts on that?
My thoughts are if they can't do surgery for whatever reason, I do send them to rehabilitation if they are lame, because I do think that there's value obviously in that, as I mentioned earlier. And I think building up their quadricep muscles and, forcing them to use that leg in whatever way is definitely going to be better than nothing. Have you had experience where the patella actually doesn't pop out anymore after just rehab? Because that,
Yes.
I would, that's great. See,
but very
didn't know that.
rarely.
Okay, very rarely. And do you think that they're grade 2 to 3s?
Yes. And what the component that I add as well that I haven't really heard my colleagues doing so much is, we're doing, all the proprioceptive stuff and strengthening the quadriceps. But what I learned from the people world is doing some like deep friction work and trying, you mentioned kind of releasing those tissues on the inside of the kneecap that are pulling it over. So I do a lot of stretching of the inner thigh muscles and doing a lot of massage and things to try to just have that be a little bit looser on the inside so it's not as likely to pull that kneecap in. So I've had some success with that whole combination.
That's good to know for me as well, because that just gives me another modality for these guys to try if, surgery is out of the question, because, unfortunately surgery is expensive and a lot of people, just can't move forward with that. And again, it's an elective procedure and their dog, isn't horrible. So it's really dependent on, like I said, it's like a kind of a group decision. They do have a lot of choices, but the main thing with surgery is if you have a dog that is limping consistently and it's affecting their quality of life, and, that's the dogs that we tend to do the surgery on for sure.
There are certainly things that can be done and taught to the owner that can help to keep them as functional, happy, as can be in terms of their lifestyle. And, I think that strict rest, hoping that, it's going to scar down, that's where I haven't had a lot of success. People are like, we didn't do anything for, 3 months and they were doing great. And then the first time, they saw a bunny and they ran across the yard, it went out again, so that kind of thing. But yeah, I do think that, we can help people and empower pet owners and, keep those pets, as functional and comfortable as possible.
If I have the opportunity to do it, I like to see these dogs even before they go into surgery and just have them be in the best possible condition to have surgery. And I think that that's going to help with the best possible outcome.
Right. And if they don't have surgery, I think that there are certain lifestyle changes that can help. Again, if you can minimize the jumping, if you can minimize, racing up and down stairs, are there other kind of risky behaviors, maybe ball chasing, fetching, roughhousing with other dogs, other risky behaviors that you two can think of?
Also, weight's really important as well.
Always.
Yeah. So, keeping these dogs trim and slim is really important. And any orthopedic surgery, if, losing weight is like that's going to do more than surgery and physical therapy. I mean, that's just huge on these dogs. So if you have a dog with a patellar luxation and your dog is overweight, that's the first thing that you can do at home to try to get these symptoms to subside and have your dog more comfortable and have a more better quality of life, I think, as well.
Yes. And what I think people don't realize is, these are weight bearing joints. So when you're carrying around extra weight, it changes how one moves and the biomechanics and, all of that. So huge impact for every joint of their limbs and their spine as well when we're talking orthopedically. So yeah. Now, when they have surgery, would you say that a vast majority of them can go back to their normal life and not have any restrictions?
After everything is healed, you mean?
Yes.
I think
long term.
Yes, I think this is a very successful surgery. I feel as though they don't get a lot of progressive osteoarthritis after this surgery. I feel like most of these dogs go back to their normal routine and they have full function for sure.
Kathy, maybe we can take a little break here. I'd like to interject an experience I had recently using the Medcovet Luma on my very own dog, Julep. The irony is that I had just researched for a client how to use laser therapy, red light therapy, the Medcovet Luma for an anal sacculitis. Now, my Julep has had issues with her anal glands and gets them expressed every 3 months. We're asleep. She wakes up, screams, jumps up like bolts. And I'm like, what is happening? Her anal gland had abscessed, created a fistula, and opened. They got her anal gland all cleaned up and examined and gave me all the instructions to do. And I said, I'd like to use the Medcovet Luma. And the vet was like, yeah, do it because that can help with healings.
And it's like you once told me, anything with an itis, anything that ends in itis is inflammation. So tonsillitis, anal sacculitis,
bursitis,
arthritis, tendinitis, exactly. And those are all the things that the Luma is good for, controlling that inflammation. So I'm glad your dog is feeling better, and I'm glad that she's back on her feet.
The other thing we didn't mention too is that a lot of these are usually bilateral disease. So they're usually in both knees, and sometimes the grade's different in each of the knees, and usually the dogs come in with a lameness on one particular leg. So again, that's the one that I would repair. And even though they have the same problem in the other, if they've never had a problem in that leg, I would leave that alone and just see what happens over time. So it is a bilateral disease for sure.
If they do have clinical signs in both, do you ever do surgery at the same time, or is it staged?
I have done surgery the same in both in the same time in a young dog that was very, very was basically crippled. And I think financially it was easier too for the people What happens is I don't like to do it at the same time for two reasons. One is it's really tough on the dogs. And I think your complication rate is going to increase with having done both at the same time. And it's really tough on owners. I mean, these dogs can't walk in their back legs. So if it's a little dog and they can carry them, that's fine. But it's still a lot of morbidity at home to have a dog that really can't walk. But if it's a larger dog, even a 30-pound dog, because it's going to take them at least 2 to 3 weeks for them to really be able to walk on those back legs. So I personally would stage it and do the one that's worse first, and then stage it maybe 3 to 4 weeks as long as that dog's doing well, because I feel like at that point they're using the surgery leg. And so now we can go do the second side and the morbidity is not as tough on these dogs as well as the owners.
I had a dog come in that had bilateral repairs, MPL repairs. And the owner called me on the phone and said she's just walking on her front legs. And so I assumed that she was probably a little dog, like a poodle or something like that. It was like a collie mix. That dog was like 45, 50 pounds.
Oh my
and
God.
it would raise up its hind end, cross the legs together, and just walk on the front legs. I've never seen it before. And that dog ultimately did end up doing very, very well with therapy. But wow.
I think I remember that dog, Kathy.
Yeah. And talk about your compensatory related,
Yeah.
things that could happen, Yeah.
And speaking of handstanding, to your point, I mean, I find as a rehabber that getting the little dogs to use the leg again is much harder because a big dog needs it for support. A little dog, they just,
it's more efficient.
Up and like, I don't need that leg at all, kind of thing. And so getting them to weight bear again, especially if it's unilateral, is challenging in those toy breeds for sure.
I think there probably are, just like anything else, personality traits and so forth that come into play.
Ask you, we've been talking about dogs. Do other species get patellar luxations?
They do. We do see cats with this problem, and we do fix cats fairly the same way. I mean, it's the same disease for the most part. It may be a little bit more traumatic in cats rather than congenital. So you may not see the angular limb deformities, although we do as well. It's not that common, but we do see them. And if that's the case and these cats are lame, we definitely fix them the same way. And it's pretty much the same recovery period as well. It's a little bit challenging in cats. I don't know how many cats you guys do rehab for, but you can't just say, okay, start walking your cat, for 10 minutes,
right.
3 to 4 times a day, slowly.
Everything is on their own terms.
Yeah, I think cats, they can be rehab, but you have to be creative in how you're going to get them to do some of these activities or exercises.
So, Kathy, are there questions or thoughts that you want to mention before we...
No, I guess I'd like to hear what Dr. Pastor's closing thoughts are as we're wrapping up. Is there anything that we can leave the audience with about patellar luxations?
Yeah, I think in general, if you feel as though your dog is having intermittent lameness and it's really affecting their quality of life, I think definitely seeing a surgeon is the smart thing to do, a boarded surgeon. I also feel as though we didn't talk about the larger breed dogs, but they can be a little trickier, and there's other surgeries that we do for the dogs that have the torsions of their femur or their angular limb deformities of their femur that are a lot more aggressive. So I do think that it's best to see or get an opinion from an orthopedic surgeon for this disease, and then together you can decide what's best for your pet, because there are, as we talked about, surgical options, multiple different surgical options, as well as non-surgical options, as well as rehab. Also, a lot of these dogs, they have an event and they're lame, and their referring vet puts them on an anti-inflammatory and rest. And then by the time they see me 2 months later, because that's how long it takes these days, they're not even lame anymore. So sometimes they are just amenable to just a quick fix, and something exacerbated it, and a quick, rest and medical management can be the trick. So not all dogs will need surgery, but if you are concerned and you want a second opinion, I think it's worth it to do that for sure.
I do too. And I'm glad you mentioned that, because so many of my clients, there's almost like this trepidation about going to the orthopedist because they think that means that their pet is going to have surgery. Yeah, not true. I mean, you're going to an expert to learn what your options are, what the best timing for things is. And I always tell my clients that any good surgeon is going to be conservative. It's not your desire to open every pet up. You want to do what's best for the animal. And to your point, you said, with any surgery, there's risks, right? And it can be infection, it could be, risk of anesthesia and so forth. So, doing the conservative approach is definitely great, but when it is warranted, you want to be in the best hands with the best surgeons. So
all these patients are individuals. And so you have to look at them individually, even though they all have patellar luxations, each case is an individual patient. So, and it could differ.
So many people, and we talked about the obesity and, oh, they're pudgy. Isn't that cute? And, oh, they're skipping. Yeah. They've done that their whole life. It's so cute. That's just how they walk. But also hearing through this podcast that it is a sign of something underlying, and again, may or may not need surgery, but I tell people to kind of monitor the frequency of that. And, maybe they were skipping, once a month, 6 months ago, and now they're skipping every day. Well, that means that the patellar luxation is progressing. And so don't ignore that. It's not just something that's cute that your dog does. I mean, look into it, consult with the expert, and go from there. Hey, one more thing before we close. We also didn't really touch on trauma. I mean, we mentioned it, here and there, but if there is a traumatic patellar luxation, does that usually need surgery?
It usually does, because in those cases, the animals are usually painful, and if it just happened yesterday and I see them, then I will give the dog a chance with medical management and rest for sure. I don't jump into surgery. But most of the time I see these dogs, a couple of months down the line, and they've already done all of those things and they're not better. And they are, as we talked about, they're more painful. And I definitely recommend doing surgery on those dogs, because I do think it affects their quality of life. They're consistently lame. It's not the skipping, it's really a lameness. And it's a little bit of a different bird, but the surgery is the same. So those dogs usually need surgery. And again, it's the clinical picture. They're limping every day, they're uncomfortable, and they're not responding to medical management and conservative management.
Right. I find that those dogs do great too, because, I think they have less of that an anatomical maybe predisposition, because it happened, traumatically. And so, their body wants that kneecap to be in place inherently.
Exactly. I agree 100%. They are definitely, like I said, there's a 95% success rate in these dogs.
That's fantastic. I love talking to experts such as yourself. I always learn more, and, things are reinforced. And so thank you for giving us your time and expertise today.
I really appreciate you guys having me here today. It was really nice to catch up. And this is my first podcast, so it's been really fun.
Good.
You did great.
You did great. And as we're wrapping up, Dr. Pastor, can you let our clients know if they'd like to reach out to you, or if they think their dog has a luxating patella, is there someplace that they can reach you?
Yes, I am at Massachusetts Veterinary Referral Hospital in Woburn. We have 5 surgeons there at this point, and it's a great place. And you can reach out to me there.
Yeah, we'll send them to the website. And it is, I had the pleasure of working there. It's a 24/7 emergency and specialty referral center. Certainly one of the best in our area. She mentioned Woburn. That's just outside of Boston, north of Boston. And I learned so much in my, 3 years there. And Dr. Pastor is a big part of that. So
you're awesome. And the program that you created there was just so valuable to our clients. And we miss you. Thank you, guys. Have a great day.
Thanks. You too. Bye-bye.
Bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at PetAbility Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.